Namaskar, aspirants. I'm Professor Verma. So today we're going to dive into a really critical topic. It's what you could call a silent health crisis, and it's unfolding right here in India. We're talking about a very dangerous link between type 2 diabetes and, well, liver damage. And the scary part? It often goes completely unnoticed until it's far too late. Now, this isn't just a medical problem, not at all. It's a massive challenge for public policy.
And I'm Dr. Sharma. Exactly. And we're going to approach this very systematically. We've broken it down into these 5 key areas you see here. You should really think of this structure as a kind of model for a perfect mains answer. Starting with the problem and moving logically to the solution, the way forward.
All right, let's jump right in. We're starting by framing this not just as some medical condition, but as a silent health emergency. From a governance point of view, these hidden crises are often the toughest ones to get a handle on.
That's precisely it, Professor. Just like a lot of other non-communicable diseases, NCDs, this problem doesn't really have that immediate public visibility. The liver damage just quietly progresses for years and years in diabetic patients. So it ends up being a low-priority issue, until boom, it hits a crisis stage.
And this right here brings us to a really startling statistic. Aspirants, make a note of this one. It's important. Nearly 1 in 3 people with type 2 diabetes could have underlying liver fibrosis. And here's the kicker, with 0 symptoms. This is such a powerful number to use in your answers, to really drive home the scale of this problem. So what's behind all this? Well, this slide makes it pretty clear. The primary cause in over 90% of these cases is linked to fatty liver disease. And look, this isn't some isolated problem. It's a direct fallout from the much wider metabolic crisis of obesity and diabetes we're seeing in India.
Right. For a truly comprehensive answer, you have to understand the how and why, the science behind it. So let's move on to our next section and see exactly how diabetes causes all this damage to the liver.
Okay, so the biological journey here is basically a 4-stage process. It all starts with insulin resistance, which is really the hallmark of type 2 diabetes. This messes up the body's metabolism, causing fat to build up in the liver. That's a stage called steatosis. Now, over time, this triggers inflammation, or steatohepatitis, that's the S and H in NASH, which, if left unchecked, eventually leads to permanent, irreversible scarring, which we call fibrosis and cirrhosis.
And here's what's so critical from a public health policy angle. Understanding what makes things worse faster. You have to realize that other conditions act as accelerators. As you can see here, things like obesity, high cholesterol, even thyroid issues, they often go hand in hand with diabetes. It creates a perfect storm for rapid liver damage. And this leads us to the biggest challenge for any healthcare system really, the silent nature of this disease. Why does all this damage stay hidden until it's, well, often just too late for us to do much about it?
This slide just illustrates the danger so starkly. You see, in the early stages, while the damage is happening, there are literally no symptoms. The patient feels completely normal. All those serious signs we think of when we hear liver failure, like jaundice or a swollen abdomen, they only show up in the advanced stage, when the damage is already severe and irreversible.
And there's a very clear biological reason for this. As the expert Dr. Vaibhav Patil points out, the liver has a huge functional reserve, and, this is key, it doesn't have pain receptors. So it can't send out those distress signals until it's pretty much on the brink of failure.
Every good mains answer needs to pivot from just analyzing the problem to actually proposing a way forward. So let's do that. Let's talk about the solutions. What can we actually do from both a policy and a clinical standpoint?
Well, the answer really is all about proactive, early screening. And the good news is we have the tools for it. Simple blood tests, fibrosis scoring systems, non-invasive tech like FibroScan, these can all detect changes early on. The policy objective, then, has to be integrating these checks into routine diabetes care right at the primary healthcare level.
Okay, now here's something that's particularly interesting, especially for us in India. It's this concept called lean NASH. What is it? Well, it's when people who are not overweight still develop fatty liver. This is a huge deal because it tells us that a simple Western model that just focuses on obesity, well, it's just not going to work for India. Our public health campaigns, our messaging, it all has to be more nuanced to reflect this reality. And that's the bottom line, isn't it? There's a window of opportunity here. That initial stage of fatty liver, it's often reversible with lifestyle changes. But once it crosses over into fibrosis, the damage becomes permanent. The urgency for catching this early, Well, it couldn't be more clear.
All right, for the final stretch, let's tie all of these threads together and connect them directly to your exam prep. How can you use all of this to actually score marks, both in GS Paper 2 and in your interview? So, let's connect the dots. How does knowing about this medical link actually make you a better informed, more effective future administrator? Let's break it down.
Just look at your GS2 syllabus. This topic fits so neatly under several keywords. It's an issue of managing health services, it's a perfect example of India's NCD burden, and it makes a really strong case for shifting our focus from a curative model to a preventive one.
So, what kind of question could UPSC throw at you? Here are a couple of potential examples. See the keywords? They're asking for analysis and a clear way forward. Your answer needs to weave together the data, the science, and the policy ideas we've just talked about.
And if this topic comes up in your personality test, here's how you can really stand out. Use that key statistic, 1 in 3. Talk about the India-specific lean NASH concept. Propose a clear, actionable policy like integrated screening. And most importantly, frame the whole thing as an investment in preventative health that will save money and boost our national productivity in the long run.
So, we'll just leave you with this final thought exercise to chew on. As a future DM or health secretary, how would you actually design this campaign? Think about it. The stakeholders, the message itself, the channels to get that message out. Your ability to think through these kinds of real-world challenges is what this exam is truly testing. All the very best.